Good morning. I am Dr. Samways, and my colleague Dr. Kim and I are here to present a brief summary of our proposal to provide contraception and preconception health planning clinical pharmacy services at the We Care OBGYN clinic. The purpose of our Women's Health Clinical Pharmacy Service is to provide management and counseling on contraceptive therapy, as well as educate and help patients of childbearing age with their preconception health planning at the We Care clinic. There's a great need to prevent higher rates of poor pregnancy outcomes, which led to an initiative to educate and counsel women on proper care prior to conception. As part of that, it is crucial to detect and eliminate risk factors that can interfere with embryonic development and lead to poor pregnancy outcomes, such as mortality and morbidity for both baby and mother. In addition, there's a need to prevent unwanted pregnancies through proper contraception methods and usage, and also prevent unwanted side effects from contraceptive therapy. Pharmacists play a crucial role when it comes to immunization screening of patients, and they can administer the proper vaccinations at the clinic. They can collect patients' medication history and determine medication safety for the mother and baby. Pharmacists can provide pharmacological and non-pharmacological resources to patients to help them with tobacco cessation, as well as educate them on the importance of folic acid supplementation prior to pregnancy. If patients have chronic conditions, we can counsel them on the importance of medication adherence and proper monitoring of their conditions. Pharmacists can be key figures for patient education and consultation. We are well equipped to educate our patients on the use and need of a medication. We can also provide safe pregnancy planning that is effective and can play a key role in preventing unwanted pregnancies and preventing poor mother and baby health outcomes.
A typical day of a clinic visit is that a patient will walk into our clinic. The patient will see the provider and explain the possible contraceptive needs. The patient will come into the pharmacy if referred by the provider. The provider will consult the pharmacy regarding the most appropriate medication and dosing. The pharmacist will electronically input the agreed dosing, and the provider will approve of the prescription. The patient will receive a consultation by the appropriate pharmacy team and then receive the appropriate medication. Consultation will consist of dosing and frequency, how the medication works, drug interactions, and contraindications, missed dose instructions, adverse effects, and patient consultation facts. The consultation will end with a teach-back summary and question and answer period as mentioned in the proposal, and the confirmed follow-up date in about a month. We can monitor certain lab values such as estrogen levels and HCG levels for possible pregnancies. We can also monitor comorbidity such as hypertension through blood pressure, diabetes through blood glucose, and hyperlipidemia through a lipid panel if there are coexisting medical conditions. Now, during this clinic visit, we can also provide preconception health planning depending on the patient's preference and PCP recommendation. In other words, if PCP deems most appropriate for the individual patient. As previously mentioned, the pharmacist will review the patient's medical record and current medications on file for any apparent concerns that may affect embryonic development in the case the patient conceives. The concerns include possible drug interactions. Pharmacists play an essential role in women's health, especially when it comes to drug therapies such as contraception, medication safety, and patient education and consulting. Thank you.